Today we're going to be discussing euthanasia, and I'll be arguing in favor of it. Euthanasia is defined as the act or practice of killing or preventing the death of hopelessly sick or injured individuals, such as persons or domestic animals, in a relatively painless way for reasons of mercy. Physician-assisted suicide occurs when a physician provides medical equipment or medication or informs a patient of the most effective use of already available means for the purpose of assisting the individual to end his or her own life. The two terms are often avoided by advocates due to the negative connotation behind them and are typically replaced with the phrase assistance in dying. For the purposes of simplicity, we're going to be just using the term euthanasia overall, usually, throughout this PowerPoint. There's different types. Voluntary active euthanasia occurs when a competent individual makes a voluntary and enduring request to be helped to die, which is essentially the direct act of killing done at the request of the individual being killed with full and informed consent. Passive euthanasia is defined as letting a patient die, such as the extubation or removal of a ventilator tube and the disconnection of feeding tubes, or the refusal to administer or take life-extending drugs, or the patient's refusal to permit a life-extending procedure or operation. This can include a do not resuscitate form and other various paperwork, and can sometimes just be this kind of thing is usually seen with people on life support and the elderly that are just to the point where they just are just not really actively doing much in general. Non-voluntary euthanasia occurs when the individual cannot make a decision or let their wishes be known, such as somebody who's in a coma or is too young, a patient that is senile, a patient that is mentally retarded to a severe extent, a patient that is severely brain damaged, or a patient that is mentally disturbed to the point that they need to be protected from themselves. As far as morality behind it is kind of subjective. On one hand, medical professionals have to uphold the Hippocratic Oath, which they took in medical school, which outlines the ethical standards that they must abide by and be held to, which usually involves doing no harm, obviously, and avoiding assisting in suicides or abortions. But on the other hand, if all resources have been exhausted and the patient is clearly miserable and informs people that they are, shouldn't they be given a way out of some sort if that's what they desire? As far as religious views play into it, the majority of Catholics, Protestants, and Orthodox Jews believe that it is unethical for a physician to assist in suicide, whereas conservative and Reform Jews believe that it is ethical in some way. The majority of Muslims believe that it is unethical and is therefore forbidden in Islam due to it being considered an act of killing, which is considered a sin. From a Hindu perspective, the majority believe that it is unethical because it separates the soul and the body at an unnatural time. It also breaches the teaching of doing no harm. There are some Hindus, however, that believe that it is a good deed on the part of the physician because it is ending a painful life. The Dalai Lama has sort of backed euthanasia to a point. He refers to it as mercy killing, and it has to be done under very exceptional circumstances. But it is up to the individual to weigh the pros and cons of each situation, obviously, so it's more up to the person who is doing it to decide. As far as the history behind it, It's been around since the 5th century BC, but the first bill outlawing it in an American state was passed in 1828 in New York. It began to gain support in the 1930s during the Great Depression, but quickly lost support a little over 10 years later when Hitler was using it as a means of execution at concentration camps during the Holocaust. In the 70s, it began to gain traction again because individual rights became more of a hot topic then. And in November of 1994, the Oregon Death with Dignity Act passed, which was the first law in American history allowing this practice. And since 2008, Washington, Montana, Vermont, California, Washington, D.C., Canada, and Belgium have all legalized this practice. Legality, it's legal in 6 states, 5 of those being per legislation and 1 of those being per court ruling. It's prohibited by law and common law in 40 states overall. And then there's 4 states where it's not on the books at all. Like there's no law regarding its legality at all in 4 different states. Those are Nevada, North Carolina, Utah, and Wyoming. Why do patients want this done? In an interview done by physicians with 35 families of those who requested this procedure, some of the reasons included illness-related experiences such as fatigue, and discomfort, loss of function, pain, or negative side effects. Threats to sense of self, such as loss of sense of self, desire for control, beliefs about hastened death, other things like that, and fears about the future, such as quality of life, negative experiences with death, and the fear of being a burden to loved ones. How is it done? A lot of people know about Jack Kevorkian, who was a physician for a very long time and had his license revoked. I didn't really read up on what, but he was on live TV, and in short, he showed a video clip of him giving somebody a lethal injection, which used to be very common practice for this procedure, but isn't anymore. And as a result, because he didn't have his medical license anymore and everything, he was charged with 2nd-degree murder and the delivery of a controlled substance, and served a short term in prison and is out on parole now, actually. Currently, physicians usually prescribe a lethal medication that the individual can administer themselves on their own time so they can take it when they feel they're ready, physically and mentally, and they're just to that point where they just are miserable. The drugs that are used are actually some of the same ones that are used for death row inmates. And I believe it's pentobarbital was recently the company refused to send it to correctional facilities because they found out that it was being used for death row and lethal injections and all that stuff. 60% of patients were prescribed secobarbital, which is Seconal, and 39% were given pentobarbital. And these are barbiturates, which are given in the doses of 9 to 10,000 milligrams, which is 90 to 100 times what is considered therapeutic for medical procedures and operations, which is an average of 100 to 200 milligrams. In the medical field, these are often used to treat insomnia and to help a patient be put under for certain procedures. These aren't just drugs; they're just used simply for this purpose. But I don't know how these numbers are obviously 2 years old, but I believe since then pentobarbital has been people have stopped taking it because the company doesn't want it being used for this purpose, because it kind of paints a negative image on the company, obviously. It's usually used for terminally ill patients. In fact, most states require that someone be terminally ill for this purpose to be given these drugs in this dose. In Oregon, which is one of the most popular states that has legalized this, there's a lot of requirements for this to be seen through. To be able to begin to take this route, a person must be 18, a resident of Oregon, capable of making the proper decision, and diagnosed with a terminal illness that has been deemed incurable or irreversible and will lead to their death within 6 months. In addition, numerous steps have to be taken before they can even get the prescription. They must make 2 oral requests to the physician separated by a minimum of 15 days. They must provide a written witness request to the physician, which was witnessed to be signed by 2 people. The prescribing physician and a consulting physician must confirm the diagnosis and prognosis, and in addition must determine whether or not the patient is capable of making this decision. If either one of those 2 physicians believe that the patient's judgment is impaired by a psychiatric or psychological disorder, they must refer the patient for a psychological exam. And the prescribing physician must inform the patient of feasible alternatives to assisted suicide, including comfort care, hospice care, pain control, things like that are legal anyway, to a certain extent at least. And finally, the prescribing physician must request but cannot require that the patient notify his next of kin of the prescription request. This is more of just making sure legality and all the legal hoops are jumped through with final paperwork, wills, setting up funerals, all that jazz, I'm guessing. So why should this be legal? It's ultimately what the patient wants. If they're willing to jump through all those hoops, they clearly feel that they're to the point where their quality of life has been diminished to the point where they just don't feel like it's worth living anymore because they're just in pain consistently. Second, not everyone actually administers the medication immediately, if at all. I couldn't really find any numbers as to how many people have passed away as a result of euthanasia or physician-assisted suicide, but according to CNN in Oregon, as of January 27, 2016, 1,545 people had been given the prescriptions, but only 991 patients had died as a result of that medication. So, whether or not that number is accurate still, I can't attest to, but clearly not all of those people had been to the point where they wanted to take that medication right away or to the point where they wanted to take that medication at all. They just knew that they wanted to have that as a backup in the event that they just got to the point where they just were miserable and their quality of life had diminished to the point where they were just kind of ready to be over that hill, I guess is the best way to put it. Patients' rights and wishes. Patients have certain rights when it comes to their treatment and how it is handled and all that jazz. And they're formed by a person's political, and their wishes can be formed by a person's political views, religious beliefs, a number of other factors. They're granted rights by both the government as well as the physician, including communication, informed consent, confidentiality, the right to health care, the right to refuse treatment, all that stuff. One of the biggest ones in relevance to this topic is probably the right to refuse treatment. You see this a lot with religions. There's a lot of different religions that have set forth very strict standards on how they want its followers to be how to go about getting medical care. Some people don't want them to go to the hospital at all. Some have their own doctors. Some have certain requirements like They can't be prescribed certain medications, stuff like that. That's probably the biggest one with this topic. And the last thing is, if an individual is a willing adult who knows and understands the consequences of the situation and is mentally stable, why shouldn't they have the right to end their life if they fit all of the criteria and requirements and are just to that point where they're ready to? Obviously, I feel like this should be something that should only be involved with terminal illness. I don't think there should be anything else but terminal illnesses. But I think it should be in place for terminal illnesses because I know what people go through with that, and I've seen the effects that can have on patients, family members, friends, even physicians, nurses, everything. So, I mean, why shouldn't they have that right to be in a position where they're more comfortable as it is? I believe there's room for improvements, though. I believe regardless of what the physician thinks, I think a mental evaluation should be required. I don't believe that a physician is the same as a psychologist or a psychiatrist. I think that they should have to go through a mental evaluation anyway because there could be underlying factors that are involved, and I think it just would be best for everybody if they went and saw a psychologist or a psychiatrist to just discuss why the patient wants to take this route. And then